ਸੋ ਆਪਣੇ ਨਾਲ ਜਿੰਨੀ ਜੀ ਮਿਨਿਸਟਰ ਜੁੜ ਚੁੱਕੇ ਨੇ, ਆਓ ਫਿਰ ਉਹਨਾਂ ਦਾ ਸਵਾਗਤ ਕਰੀਏ।
Good morning, Minister.
Good morning.
Good morning. How are you?
I'm well, thanks. How are you?
Good, good, good. Look, healthcare is in the news lots. Doctor shortage, healthcare worker shortage is in the news lots. So, what kind of an update do you have for us this morning?
Well, you're right, and that's why we are taking action to make BC one of the most attractive places to work and putting an advertising campaign into the U.S. to recruit American doctors, nurse practitioners, and nurses to move to beautiful British Columbia and come work in our healthcare system here.
So, what kind of success have you had so far?
Well, it's been an incredible campaign. We announced it in March. We launched it in June and July, and we have already seen over 1,400 job applications from American doctors, nurses, nurse practitioners, allied health professionals, and we've had 140 healthcare workers accept job offers here in BC in the public healthcare system. And what we're hearing from them is they'll be practicing in communities big and small throughout British Columbia. They're really excited to move here to a place that has a universal healthcare system that makes sure that people have access to the healthcare they need no matter what their income level is, and that we have really beautiful, diverse, and inclusive communities, fantastic places to raise their families, places for their spouses to find employment, and people are really excited about moving to British Columbia and being part of strengthening our public healthcare system here.
Minister, that seems like a great success for a program. According to the data you have, how many more doctors does BC need in order to make sure that everyone has a family doctor?
And that's exactly what we want. Everybody who wants one needs to have a primary care provider, whether it's a family physician or a nurse practitioner. So we are not going to say no to anybody who wants to come up from the U.S. or to come from other provinces or countries to join our healthcare system here. We're going to keep working to add more doctors. We're adding more doctors here in British Columbia at a faster rate than any other province in Canada, and attaching more and more people every single day. But we know there's more work to do, and that's why we're going to continue the work with the BC College of Physicians and Surgeons, for example, to streamline the credentialing process, make it faster and easier for people who are trained in other countries to come and work here. That's why we're going to continue to use services like Health Match BC, where a doctor wanting to come from the States is working with an individual recruiter who's able to answer all of their questions, connect them with health authorities, and ensure that there's a good match in terms of where they might land and where they might work. We're really taking a Team BC approach to this, and we're going to continue this work because we need more family physicians, we need more specialists, we need more nurses, and we're going to do everything that we can to continue to build and strengthen that healthcare workforce.
So let's say I'm a doctor in the US. I'm practicing in California. I see this opportunity. I apply to come to Canada. What process do I have to go through to be able to practice my profession once I'm in Vancouver?
Well, there's a number of things that a doctor in that case would need to do. So first of all, being credentialed and licensed to practice here in British Columbia, working through the College of Physicians and Surgeons, and they've made a number of changes lately that make it easier and faster, more streamlined for people to be able to do that. Moving your family from the U.S. into Canada, of course, is no small thing, and that takes work and time too. The kids need schools, or maybe daycare or childcare is needed. Again, the actual process of moving, going through the immigration process. So there are expedited pathways for healthcare professionals to come into Canada, but of course that's some of the paperwork that needs to be done too. And that's why we have people on deck to help with that process and help to answer those questions. But to see that 140 people have already accepted job offers, there are people who have been thinking of moving to BC for some time, and they're now practicing here in BC. And yesterday, we heard directly from one of those physicians who moved to British Columbia. She's practicing in Kamloops. She's moved her whole family here and is so proud to be practicing medicine in a place with universal health care, somewhere that really matches the values that she has, and to be providing top-notch health care to people here in BC.
Minister, we hear from rural communities all the time about the doctor shortage in rural communities, but right here in Surrey, the second largest city in BC, we are also hearing from our people down here that it is very difficult to find a doctor. So, what steps are being taken to make sure doctors are going where they are needed?
Well, yes, Surrey is the fastest growing municipality in British Columbia. That's why we're acting now to make sure that people in Surrey have access to the healthcare services that they need now and into the future. And that starts with primary care access. That starts with adding more family physicians through the new family physician payment model. More community physicians are practicing in Surrey. We've added over 200 new physicians in Surrey, like at Surrey Memorial Hospital, for example. We've had a 200% increase in nurse practitioners in Surrey, doubled the number of nurses. This is the kind of work that needs to continue to happen. In addition to bringing in healthcare workers and physicians, the record investments that are taking place in healthcare infrastructure in Surrey, through the Cloverdale Hospital, the new renal center at Surrey Memorial, the new cardiac cath labs, a new medical school coming to Surrey, adding a new acute tower in the planning phases now for Surrey Memorial. This is the work that has to be done so that Surrey and people living south of the Fraser have access to the healthcare services that they deserve. We know that Surrey needs to catch up, and that's why we're so focused on delivering in Surrey.
Thank you, Minister, and thank you for taking the time. And we look forward to having you back to giving us a bit more Surrey-specific update. But thank you for today.
So happy to do that. Thanks so much.